This is SG2 Perspectives, a conversation with industry experts and SG2 thought leaders about the biggest trends in healthcare and what we all expect that's going to mean for the future of healthcare delivery.
So in about 8 business days, we went from concept of this, what might be cool, to actually on one of the webinars, kicking it off and commercializing it. And within 4 business days after that webinar, we had over 130 employers reach out to us proactively asking for more information that they want to be part of the program.
Welcome to SG2 Perspectives. I'm your host, Trevor Durin. And on today's really exciting episode, I'm fired up because we have a member guest from Ochsner Health, Donny Lawrence, Vice President of Business Development. And I asked Donny to share the success they've had with direct-to-employer strategies pre-COVID and how that work allowed them to pivot and offer employers solutions tailored to the very nuanced and unique problems that they're facing today. So we're going to jump right in with Donny. Can you start by just giving us an overview of really the health system's historic perspective on direct-to-employer strategies? So pre-COVID, many of our listeners, and myself included, heard about the national press you received for some of your Center of Excellence approaches. So why was direct-to-employer an important strategy for Ochsner?
Just to start off, thank you for inviting us to speak with you guys today. We're always excited to talk about some of the new initiatives we're working on, but the overall employer strategy that we've embarked upon at Ochsner Health, we started a little bit over 2 years ago. And we were seeing a downward trend in our commercial mix, not dissimilar to other health organizations around our region and certainly around the country. We have a flat population growth. We have the age-ins of Medicare like everybody has, and we're a state that expanded Medicaid. And so all 3 of those factors together had a little bit of a decreasing or downward pressure on our commercial mix. So we figured if we could come up with a strategy to capture more of the commercial business from a share perspective, that it would probably be financially beneficial to our organization. And we figured that if we could just get the patients in the door, our clinical programs would really speak for themselves, and then we could create stickiness with some of these programs that we're working on. So we built a fairly robust infrastructure. It consists of not only a series of products and solutions, but also a team behind the scenes to actually pull it off. So from a solution standpoint, we created insurance products with payer partnerships. We have a corporate wellness team that focuses on biometric screenings as well as comprehensive wellness programs. We got into the occupational health business. In our innovation labs, we developed some digital chronic disease management tools, as well as our virtual urgent care offerings. And we have other wraparound products as well that we kind of call value adds, but we were effectively able to take all of those solutions and package them and commercialize them and be able to provide direct to the employers the ability for them to participate in some of those things. And so we created a sales team, not dissimilar to our regional sales team that we've had before with our referral and transfer business, but one that focused really on calling on employers as well as working with the local broker community to help us sell some of our products through them as well. So we've been at this for a little over 2 years, and we've had some pretty significant success. We now have relationships with just over 1,800 companies here locally in Southeast Louisiana and into Mississippi.
Wow.
Yeah, and really started with very, very few. The vast majority of those companies that have done business with us have actually chosen to be part of some of our insurance products, our accountable care network, or what people would call narrow network products. And they're saving significant money on their premium. And we do that both in the fully insured and self-insured world. And the other few hundred companies that we have are mostly in the corporate wellness and occupational health space. And here recently, for all the reasons why you might know, our digital solutions have just taken off. We've quadrupled the digital partnerships we have with employers over the last 6 to 8 months.
That's an impressive starting place, which having those existing relationships with employers must have been such a great channel to quickly hear their evolving needs this spring. And now we're into a couple days into early summer. So what did your employer partners, what were they asking for? What did they need? And what kind of offerings were you able to build as a response pretty rapidly?
Yeah, this was really fun. Obviously, when all of the stay-at-home orders and mandates started coming through, everyone was in turmoil, and it was really complete chaos, right, around the entire country. And we needed to quickly pivot it to determine what we were going to do as a business, because we ourselves are a business within a business, right? We're our own little business unit. It didn't take us long to figure out and to kind of lean back on the core competencies of Ochsner Health. And we said, you know what, if we could just do nothing more than be a resource for the employer community and specific to the employer community, maybe that would be helpful. And from a resource perspective, we didn't know if anyone would buy any solutions, or we didn't know if anybody needed to change their insurance or anything like that. So we just decided, instead of taking that approach, we were going to be the clinical experts around COVID and around the disease state, what we're seeing here locally. And so we basically started off with invitations to our employers, just south of 2,000 employers around the region, and invited them to webinars. And we decided to host a weekly webinar for the employer community. And we started off with, what is COVID? And we really used our clinical experts to explain to the general population what it is. I mean, really from a real elementary standpoint, all the way to what we can expect, and also being very transparent on all of the things we don't know. And we had wild success with the number of attendees that joined the first one. And then because of that, we said, well, let's just continue this momentum. So we started the weekly rhythm. And for the first 4 to 6 weeks or so, we really focused heavily on clinical content and being a clinical resource for the community. And we handed it off in a kind of a concierge way to the employer and broker community. Well, as the phased reopening or the restart of the economy started becoming a real part of the conversation, employers started to say, this is all fantastic. We understand the clinical aspects now. Thank you very much. But my goodness, can you help us get back to work? Can you help us provide peace of mind for not only our employees, which is very important, but also our potential customers? You yourself, Ochsner, are an employer. You have 30,000 employees. Clearly, you're doing something. And because you're the clinical expert, we kind of want to learn what you're doing, and we want to potentially embark on some of the same strategies you're doing. We don't know what this looks like, but can you help us with some turnkey, safe to return solutions? So this is where it really got exciting. In about 8 days, and I don't mean 8 business days, I mean 8 straight days in a row, we created another sub-company for safe to return. And we included an infrastructure, a pricing mechanism, invoicing, levels of support. We have basically a do-it-yourself option that gets you part of the club. And then we have an ongoing support from a consulting perspective. And most people, when coming into this, when we started asking what they were looking for testing, both antibody and COVID PCR testing. At the time, antibody was really brand new and people were interested in it. How do you help with screening the employees and the people coming in to my business? What do we do there? How can we use your labor for that? And also in signage. We have a lot of signage around all of our health system facilities as you walk in, from elevators to COVID education to telemedicine to social distancing and masking. And instead of them recreating it on their own, they actually found a benefit in using Ochsner branded signage. And so we gave them abilities to buy that. And then also some levels of PPE where we could supply that. And we outfitted every type of agreement, every arrangement that an employer would have with us through Safe to Return. We gave away a virtual employer clinic to help migrate their utilization from traditional bricks and mortar into more of a virtual setting. And then once again, had a few wraparounds there as well. So in about 8 business days, we went from concept of this, what might be cool, to actually on one of the webinars, kicking it off and commercializing it. And within 4 business days after that webinar, we had over 130 employers reach out to us proactively asking for more information that they want to be part of the program.
That's really impressive. It's taken me more than 8 days to write some emails. So I'm just really impressed. That's amazing. Were there any kind of rapid learnings or things that you could have done different, or things you've learned already, or adjustments you've had to make trying to roll that out so quickly? I can see exactly how it fits really well and meets such an important need to just give people peace of mind. But any early learnings?
Thank you for asking. I think there's a couple. The first one is interesting. I think had we really taken the time to scope this out and to talk to every internal stakeholder and to make sure we had all of our I's dotted and T's crossed, we'd probably still be planning it. And I think we would not have been able to go to market. And we certainly wouldn't have been able to go in 8 days. So our organization had some impressive executive support that says, go out there and do something. Try as hard as you can, obviously, to make it viable and make it work, but don't overthink it. Go. And I think that is that's a testament to how our organization thinks and and the speed that we like to move at. But it's also a real key learning. I've talked to other health systems, and they're still in the phase of internal discussions, and it really just paralyzes the ability to move fast. So I think that was one learning, that we just had to go with a product that we believe was at least minimally viable. And throughout the course of this, the needs have actually changed. When we first started, the biggest thing that companies wanted was the perception of safety, that companies were really willing to buy and engage with us so that they could at least show their employees and their customers that they were safer than the competitor or the other business next door. And it was that perception that they were really looking forward to. And then as they started getting some of that and got a lot of good feedback from their employees, at least being proactive on this, then it started off to the second level. They wanted facility support. They wanted us to come on site and actually tour their facilities. And so we pulled together a team of facility survey experts, all the way from infectious disease, occupational health. We leveraged some of our Joint Commission survey experts to come with us. We had signage experts from marketing. We developed this little team, and we went on site and we provided detailed on-site recommendations for all the businesses we walked through, and then followed that up with a written document and assessment as well. And for the people who have signed up for our ongoing monthly support, we recognize that we are constantly being asked new questions that we didn't think of, and the employer didn't think of, and that they really started to now buy the retainer or the peace of mind that all they have to do is pick up the phone and call us, and we're engaged with them. And so that's kind of how we've evolved that over the last few weeks. And it's funny to say all of this because it's really only happened over the last few weeks.
Right. The idea of health expertise has never been so valuable. So as you maybe try to anticipate what kind of the next wave of needs is going to be from these employers, particularly as we go into 2021 enrollment, what do you think some of those needs will be? Are you building new offerings, solutions, ways to continue this level of access to health experts?
Clearly, we at least internally are proud of is some success here with the Safe to Return. And that's all about getting a business back up and running. And it's a little reactive in a way, like I had to shut down and now what? And so we said, I bet we could take this one step further and really kind of do a Safe to Return 2.0. And clearly we aren't so creative in our naming here. But what we learned clinically through COVID is that a lot of the people who had poorer outcomes had pre-existing conditions, obesity, hypertension, diabetes. And it just so happens that we have solutions that target those disease states perfectly, like one for one. So we actually think that we're going to parlay the Safe to Return 1.0 and getting back to work to a Safe to Return 2.0 and back to wellness. Because now if we can help an employer keep their workforce healthy or create more health in their workforce, the outcomes, if someone gets COVID, would be potentially better than without. So we're going to probably kick off in late Q3 or mid Q3 a return to wellness program that is multidisciplinary, that contains fitness center information, biometric screenings, comprehensive wellness, weight loss programs, chronic disease management, better access to care, and all sorts of other things. And we're going to package that as the next solution set. We are also not forgetting about our core business. So Safe to Return 1.0 and Safe to Return 2.0 is fun, but we are still there for the core business needs that aren't going away. We're still helping employers reduce their costs by providing alternative insurance options. We certainly are helping them with their pre-employment and their post-injury work, and that's not going to go away. And we're certainly going to be there for virtual care and chronic disease management. So we're trying to now balance our core business with these other new business lines with effectively the same business development staff.
Donny, as you're kind of re-engaging with employers as they're thinking about 2021 enrollment, do you think some of the slow trends we've been seeing in movement to more capitated contracts, value-based contracts, where employers kind of know and understand the subsidy that their commercial insurance is providing, but start to think about it from your perspective too and say, yeah, let's take the risk together. Let's go in it together, and you can help us reduce the total healthcare spend for our employees. Do you think actually COVID and kind of the new economic reality may increase employers' appetite to try some new things?
I am a business development guy, so I like to think with the glass half full that is going to be a case, right? There's going to be a market opportunity. And I think what we've seen so far is it's really kind of a double-edged sword. On one aspect, the financial conditions of the marketplace are causing all businesses to relook at their cost structure. And in that particular case, health insurance benefits for their employees is very expensive. And so cutting 8, 10, 12, 15, 20% off of that is certainly appealing. And I believe more people are going to look at that. However, on the other end of it, too, is that employers that are staying in business and want to keep their employees, keep their kind of paternalistic philosophy on benefits, they're still struggling a bit with alternative insurance programs seeming like a reduction of benefits. And we're actually working with a few companies right now that financially, it really makes a ton of sense for them to change contribution methodologies and change programs in order for lower expense. But it seems like it's almost the last thing they want to cut. And so I guess we're going to play it out and see. Now, I will tell you that more sophisticated companies, larger self-funded companies, over the last year, and we're a less progressive market overall, but over the last year have started to shift away from fully insured business to self-funding. And some are looking to go from self-funding to direct contracting via TPA. And that's very complicated, as you know, and it's going to take both brokers and health systems and employers working together to solve for that. But I think the financial crisis is going to have to linger a bit more before the average company makes these big jumps. Just an opinion.
That's all I was asking for. So thanks for sharing it. Well, Donny, is there a component of this program you're particularly proud of that I didn't ask about? Something that you thought was new, innovative, cool, different, that really moved the needle here? I love the simplicity. I love that it's responding to a really clear market need that really only a health system of your stature could provide locally. So it makes absolute sense, a value proposition from the company's perspective. Did it lead to business in other areas that you hadn't anticipated? Do you think it's going to be a bridge to some new things? What haven't I asked about that's a cool feature of this program?
Obviously, our health system, like all the others, we lost a ton of money during the the stay-at-home orders and hundreds of billions of dollars, they just start to all seem the same. So we never did embark upon safe to return to fill our margin hole or our margin loss. It was, in fact, about creating value for employers and engaging with the employers at a different level of their organization. This was the first time in 2 years that I would say 90+% of the companies we're interacting with, it's the CEO that's interacting with us. It's the owner of the company. It's the president. It's the executive team. And so the audience that we've been able to get and prove our value to is at the highest level of the organization. So the real play here is let's create a value add for businesses now for them in hopes that our implementation of these services will yield favor so that we can move on some other larger initiatives in the future. So we're working directly most of the time. The broker is involved, but not to the extent that the broker would need to be involved in the insurance space. And so a couple examples is we've talked with some companies who were very pleased with our response here and very thankful. And the simple question was, this is great. If all of this works out well over the next couple months, I'd love to have an audience to talk with you about some of these other initiatives. And the overwhelming 100% response has been, absolutely, I'll see to it that that gets set up. And so that has probably been the single coolest thing. And we're under contract now with almost 50 employers. And we'll probably wind up somewhere around the 75 mark by the time it all is said and done over the next month.
Those are big numbers for a program that, like you said, is only a few weeks old. And thanks for sharing that detail. That sounds like such a great, from the BD perspective, foot in the door, but it's really about an audience that's going to understand your higher level value pitch. And it's not going to be about kind of the incremental changes to what the benefits look like. It's going to be about a bigger shift and a bigger relationship. So that's really neat and hopefully something you can leverage going forward. Donny, thanks so much for sharing some of the learnings, challenges, but a lot of the success of your program so far. Thanks for joining us on SG2 Perspectives. And as always, I like to recommend another Vizient podcast, The Modern Practice. It's on Vizient's Medical Leadership channel and provides a clinical perspective into current issues affecting healthcare today. Thanks so much to our listeners for joining, and special thanks to Donny Lawrence and Ochsner Health for sharing their story.
Thank you, Trevor.
This has been another great episode of SG2 Perspectives, where industry experts and SG2 thought leaders explore the drivers of tomorrow's healthcare strategies to inform today's decision makers. Contact us anytime by sending an email to sg2perspectives@sg2.com. We'd love to hear from you. SG2 revolutionized healthcare demand forecasting with the Impact of Change forecast, and today we're the industry's premier strategy advisory firm. To learn more, visit sg2.com. Thanks so much for listening, and we'll see you again soon.